So the union budget, what is very surprising is that there are very few countries in the world that there's so much sound and fury around the union budget. And it's mostly something that is done in a planned economy, a highly centralized economy. And unfortunately, after 60 years, we still remain largely a planned economy. And that tells us why the budget is such a big deal for the Indian economy as a whole. This particular budget is a make or break budget for this government. What they do need to realize is that patience is running thin. The government has to spell out greater clarity in its long-term vision, and that is what this budget is meant to do. It's really a medium of long-term strategy, specifying a long-term strategy for broad development. And in that sense, the budget this time will be very, very important, more than the last budget. And the general sense is that there is, because of the pressure the government is going to let out, it's a big budget, they will come out with a little more clarity on what they want, which way they want to steer the economy. Now, fundamentally, they need to lay out their vision on how they plan to deregulate, how they plan to move ahead with, the infrastructure. What is their vision on healthcare and education? But beyond that, announcements about how much, what the intended spending will be in each sector is really not going to be that much of a big deal, primarily because it's not the nature of the spending which will determine the policy, but the devil really is in the details, at least as far as this particular government is concerned. So we do expect lots of announcements, but what I would like to see are more details on exactly how this money is going to be spent, who is going to be responsible. Are we going to see a greater devolution in terms of states taking ownership of designing some of these long-term strategies? So the state governments, for instance, it would be nice to know that they are being delegated the authority or the responsibility to come up with a vision for healthcare over the next 20 years or education over the next 20 years. What they can do at the center is to push forth the stalled infrastructure projects, because it has been now 5-6 years since we have made these long-term fixed investments, and we are yet to see a cash flow or finalization of these infrastructure projects. So we have lots of stalled projects, and we need to really push forward on that. The one thing I completely agree with Deepak Parekh on is that the ease of doing business in India really hasn't got any better. And in that respect, I think the government's announcements have to be a little bit legal in nature by saying that they are going to make the processes a little less cumbersome. And that might even explain, why we've not had too many private initiatives, even if it is in the space of higher education, where though legally foreign universities are allowed to come and set up universities, we've not had even a single one of them come and set shop. And largely it has to do with, complete lack of understanding or clarity, not just limited to the health bill, but also broadly, the rest of the bureaucratic requirements in setting up private universities. So it would be good to know that the government is serious about deregulating the higher education space by laying out a little more clarity on how we can go about that. In the healthcare space, while we've had the National Health Policy announcement, which is aspirational in nature, and most of us support the aspirations of the government, but there needs to be clarity on where are we going to put the funds. And for those of us who understand what is public goods in nature, healthcare really is predominantly a public good, if you consider the early life of diseases. So we have to put greater emphasis on primary and preventive healthcare, because that's the nature of the sector, that these diseases and just primary healthcare has great scale because everyone seeks primary healthcare, but the margins in terms of providing it financially in a viable way is very narrow. So private sector players are unlikely to enter the space of preventive or primary health care. While we've had enormous growth in the secondary and tertiary space, we have great super specialty hospitals set up in the private sector because the margins are immense, and we really are emerging like a regional superpower in the tertiary healthcare space. But our primary healthcare is really in tatters. And that has largely got to do with this complete lack of understanding that if I fall sick, whom do I approach first? What are the responsibilities of the government? We have complete breakdown in the primary and preventive healthcare, and there the government needs to put much greater emphasis and greater clarity on the vision. Finally, I'd like to talk about gender issues. We've had the new Delhi government make safety of women as one of their primary concerns, and we greatly welcome that. But we would also like the central government to reiterate and reinforce what was also part of their manifesto by announcing much more deliberate and much more, again, responsible policies as far as women's safety is concerned. But beyond safety, I think women's issue have to be addressed even within the labor markets. For instance, equal pay, access to markets, access to joining the labor force. Because it is quite a mystery, it's an enigmatic problem in India that while the girls, despite all the oddities of nature and society in the early lifespan, they do very well. They do exceedingly well in the 10th and the 12th exams. And then we have a steady decline in labor market participation. So what happens to all these bright girls? Why do they drop out of the market space? So clearly there is something to be done as far as making the labor market or job scene a little better for women to participate in. And it's a great way to, through job creation, it's a great way to level the gender inequalities that we have in this country.